Hello and welcome. I'm Pam Johnson, Chief Nursing Officer for Mayo Clinic. While you are a patient with us in the Mayo Clinic health system, be assured that your safety is a primary focus of our care. We also believe that you and your loved ones are a crucial part of providing care that is safe and of the highest quality. During the next few minutes, we will share important information with you that will help you better understand how we provide this care, what you can expect during your stay, and how you can help us care for you. After you watch this video, your nurse can answer any questions you may have. If you have any questions or concerns during your stay, please feel free to talk with anyone on our team or ask to speak with the hospital's Chief Nursing Officer. Thank you.
While you are in our care, there are many things we do to provide you with the safest care possible. These are procedures you and your loved ones will see and hear us do time and again while you're here. Even though it may appear we are repeating ourselves, these repeated actions help us pay attention to detail and are for your safety. When you arrive, we place a bracelet on your wrist. It has your name, date of birth, physician's name, and hospital record number printed on it. You or a loved one should make sure that this information is correct because it is the most reliable way to identify you during your stay. Keep your wristband in place at all times. If it is lost or damaged, ask for a replacement. We will verify your identity frequently by looking at your identification bracelet and asking you your name and date of birth. By doing this, we can be absolutely sure we are performing the right procedure or giving you the right medication. If our staff does not check your identity when you think they should, stop them. Tell them who you are and ask them about the medication they are dispensing or procedure they are about to perform. We need you to be a very active member of the team. Your personal allergy information is also very important. While some allergic reactions are as simple as a rash, others can be much more serious. If there are medicines, foods, or other things you or your physician believe you are allergic to, please be sure to tell us. We will place a red bracelet on your wrist with the word allergy on it. The red bracelet alerts us to check your records to ensure we don't expose you to the food, medicine, or other items that can cause problems. If you believe you have one or more allergies but you haven't been given a red bracelet, tell your nurse. We will update our records and provide you with a bracelet. We also take special care to prevent you from falling while you're here. Your nurse will ask you some questions to determine if you would benefit from extra fall prevention measures. If you might benefit from these precautions, we will give you a yellow bracelet. This bracelet lets our staff know that you might need extra help getting into and out of bed, going to the restroom, or walking in the halls. Most importantly, you can help us prevent a fall. Always use the nurse call button to get help before you get out of bed or get up from a chair. It's not an inconvenience for us. We are here to help, even if it means we just stand by to be sure you are safe. It's also important for you to wear skid-proof slippers or gripping socks to prevent slipping when you are out of bed. By working as a team, we can prevent falls and get you home sooner. Our staff takes many steps to make sure you receive the right medication, the right way, at the right time. When you arrive, we create a list of all the medications that you have been taking, whether it was prescribed by your physician or you simply purchased it off the shelf at a drugstore. For example, you may be taking a prescription drug for high blood pressure, but you may also take vitamins, supplements, aspirin, or other non-prescription medication. We want to know about all of them. Your doctor needs to know exactly what drugs you are taking before any additional medications can be ordered for you. Then, we send a list of your home medications and any new medications your provider has ordered to our pharmacy. There, a pharmacist compares the medication orders with the medication list one more time. If there are differences in the dose or the directions need clarity, the pharmacist calls your doctor for more information and suggests a change if needed. Our pharmacy computer also checks your entire list and alerts the pharmacist of any potential drug interactions or drug allergies. Then, our pharmacists check every medication one more time before they send it to the nursing staff to give to you. Finally, when your nurses give you your medication, they verify the type of drug and the dosage, as well as how and when you should receive it. Our purpose is always the same: the right medication for the right person, the right way, at the right time. Here again, we need your participation. If the medication doesn't look right or feel right, or you want to know more about it, ask us questions anytime. If you feel differently after you take your medication, tell us, whether you feel worse or better. We need to know how medications make you feel so we can change the dosage or make other adjustments. When you go home, our doctors, pharmacists, and nurses work together and support each other to make sure you will be taking the correct medications at home as well. The pharmacist will bring you a list of all your medications and will review them with you before you leave. We want to communicate clearly with you and help you understand what you are taking, how to take it, and why you are taking it. This is another great time for you to ask any questions related to your medication. Safe medication use involves both you and your caregivers from the minute you arrive to the minute you leave. You've been learning about some of the processes that we use to help ensure patient safety. Another process we'd like to tell you about is called the Universal Protocol. You can just call it a timeout. The timeout helps us make sure that we have the correct patient, the correct procedure, and the correct location on your body each and every time we do a procedure. You can and should be an active member of your team during the timeout. Here's how you can help. Verify that the information on your patient identification bracelet is correct. If it isn't, tell us. Verify that the surgeon has used a marker to show the correct location on your body where you are to have the surgery or procedure. And tell us if it isn't where you think it should be. Ask any questions you may have and continue asking until you understand the answers. Expect to be asked your name, birth date, and what procedure you are having several times. The timeout is something we do before each and every procedure. You can feel confident that we take these safety checks very seriously. When you're in the hospital, we want your stay to be as comfortable and safe as possible. During your stay, your provider may prescribe a blood-thinning medication as well as sleeves that are wrapped around your legs to prevent blood clots from forming. These sleeves, called SCDs, prevent blood clots by gently squeezing your legs. Blood clots in your legs can be a serious, sometimes life-threatening problem that can occur when you're spending a lot of time sitting or in bed. If your provider has prescribed SCDs, they should be worn whenever you are in bed or sitting in a chair. For your safety, don't stand up while wearing the leg sleeves, and don't put on or take off the sleeves by yourself. Ask the nursing staff for assistance anytime you need to get up while wearing SCDs, or if you have any other questions about the devices. The medical center uses a concept called rapid response to meet certain special needs you might have during your stay. The rapid response team is a group of experienced staff who can be called to your bedside at any time. The goal of rapid response is to recognize and prevent serious medical situations. The nursing staff has criteria they use to activate the rapid response team, but the nurses may not be as familiar with your usual state of health as you or your family are. You or your family may sense things before they are observable by our staff. If you or your loved ones feel that your condition is worsening in ways that staff might not recognize, ask your nurse to call the rapid response team. The team can provide additional support for your nurse and assist with your care until your physician can be consulted or can come to your room. When you are a patient, you have certain legal rights. Your nurse will give you information about those rights. For instance, You have the right to know who your doctor is and to refuse treatment you don't want. You also have some responsibilities that will be explained to you. The most important one is to participate as actively as possible in your care. Ask questions. Tell us about allergies. Wash your hands frequently and ask us if we've washed ours. And tell us your suggestions for improving care. Your participation is important in our effort to provide you with safe, effective care.
I'm Dr. Rob Nesi, Chief Executive Officer of Mayo Clinic Health System. When it comes to your care during your hospital stay, the most important relationship is the one between you, your loved ones, your healthcare provider, and your care team. Working together with you, Mayo Clinic Health System staff are here to make sure that your care is safe and effective and that you, the patient, are always the most important person in the room. If there is more that our staff can do to make your stay more comfortable, please don't hesitate to ask us. Thank you for choosing Mayo Clinic Health System for your care.